They told you it's burnout. They lied. It's nurse trauma. Your body never lied. The system did. I'm Dr. Lorre Laws. Let's heal the root cause. I want to take you back to August of 2022. I'm standing on a convocation stage at the university, and my daughter is standing in front of me in her graduation regalia. I had placed a master's hood on a lot of students over the years. This time I was placing it on my own kid. She graduated summa cum laude, top of her class. She earned the Clinical Excellence Award, the one for the skills that matter the most in settings. She chose hospice, and she had already signed her first contract. And while my heart was full, I was also silently crying a different kind of tears inside. The kind I didn't dare tell anyone about that day, because I knew what was coming. I knew what happens to almost every new graduate nurse within months of entering their practice. And sure enough, less than 3 months into her own practice, my daughter said to me, "Mom, I think I've made the biggest mistake of my life, becoming a nurse." Now, if you've ever said those words or thought them quietly on your drive home after a shift, then this episode is for you. Because what happened to her is not a her problem. It's a pattern. And today I'm going to tell you about the pattern and the science beneath it all and what we're going to finally do about it. Let me tell you what my daughter walked into. And remember, she had every advantage. She lived under my roof while I was literally doing the nurse trauma research and writing the book on the exact same subject. She had one of the most respected nurse coaches in the country mentoring her throughout her transition to practice. She was educated, trained, supported, prepared, and so deeply loved, and it didn't seem to matter. Within weeks of her employment, they moved her from hourly to salary. They sold it to her by saying that on slow days, she could be done in the afternoon and take the rest of the day off. A slow day in home hospice as a new graduate nurse with 14 to 16 patients spread across a 3-hour driving radius. She was out in the field for anywhere from 10 to 12 hours each day, and then she came home for at least 4 to 6 hours of charting and returning phone calls. And as I observed her transitioning into her practice, the symptoms emerged one by one, almost as on cue, right in alignment with my research. The GI distress, the anxiety, the insomnia, brain fog, memory lapses, hypervigilance, depression in under 3 months of practice. And here's the part that really matters. This is not rare. Across the international peer-reviewed evidence base, up to 30% of new graduate nurses leave their job or the profession entirely within the first year. And by the second year, those who can white-knuckle their way through it, well, somewhere between 37 and 57 of them are gone, depending upon what specialties one is studying. So it's not a workforce with growing pains. It's a workforce that's being consumed at the entry point. And it's not just leaving. It's what's happening to the new graduate nurses' bodies while they stay. And it happens to all nurses, even after they transition into practice. 96% of nurses report PTSD symptoms. Nearly 1 in 4 meet the diagnostic criteria for PTSD. This is the same or greater trauma exposure as military combat personnel. Workplace violence. 2 nurses are assaulted every hour in the United States. In 2023, Press Ganey recorded over 23,000 assaults on nursing personnel. That's a 64% jump since just 2019. 81% of nurses reporting experiencing workplace violence. And the Bureau of Labor Statistics says that nearly 73% of all workplace violence injuries that cost someone time off of work happen in either healthcare or social assistance. These are not isolated incidents. This is the structure. And nobody handed my daughter a single tool to survive it. None of us got tools to survive it, let alone thrive within it. Now, I want to pause here for just a second because if any of this is landing in your body right now, I have built something just for you. It's called the Nervous System Reset, and it's a live 3 half-day event that is happening June 26th through the 28th. A small group of nurses who will be in the virtual room with me will be doing the real work of regulating a nervous system that has been stuck in survival mode for years. It's the only live event I'm running in 2026 for a deep dive, and the enrollment closes on Sunday, June 7th. You can find everything at drlorrelaws.com/reset. That's drlorrelaws.com/reset. Now let me show you the science underneath all of this. Here's what nobody told my daughter, my students, thousands of them, and probably nobody told you. What we call burnout in most cases isn't burnout at all. Dr. Karen Foley at Purdue University published a middle-range theory for nurse psychological trauma back in 2022. 7 distinct types of nurse-specific trauma were described: vicarious, secondary, workplace violence, system-induced trauma, insufficient resource trauma, and of course those that are unavoidable and come with the profession's second victim or vicarious, and disaster trauma. My daughter's first 3 months in her practice hit on 4 of those 7. There was the system-induced trauma, what happens when the institution's own policies and staffing ratios and budget decisions reliably injure the people inside that system, not by accident, structurally. Insufficient resource trauma, that's being asked to deliver a standard of care the system will not resource. Your clinical conscience knows exactly what the patient needs, and every shift, the system makes you fall short of that standard, of what the evidence base mandates. That is a moral injury that lives inside the body. And here's the science that ties it together. In 7 years of nurse trauma research, I discovered that 76% of what the profession calls burnout maps directly to nurse-specific trauma symptoms. Nurse-specific trauma, not stress, not weak coping, not a resilience deficit, and certainly not burnout. Trauma, which is identified and described in the peer-reviewed nursing science. This matters because the treatment for burnout and the treatment for trauma are not the same thing. You cannot just self-care your way out of a dysregulated nervous system. You cannot bubble bath your way through sympathetic overdrive. And when your system is stuck in survival mode, a wellness app just isn't going to do the trick. In fact, it's an insult. The body keeps score whether the system is keeping track or not. And for 5 decades, the burnout diagnosis has been wrong, which means that the interventions and the resources and the supports have also been wrong, which is why in 50 years we have not materially moved the needle on nurse burnout. That's because it's not. Burnout is a symptom cluster of nurse-specific trauma. So let me tell you what becomes possible when we get the diagnosis right. When a nervous system in a nurse finds its way out of survival mode and into regulation, everything changes. The dread before a shift, it starts to lift. The startle response settles. The sleep rhythms and quality come back. The clinical discernment and judgment sharpens because the brain is no longer running through every decision in survival mode through a survival lens. This is what I call Nursing 2.0, the Nurse Safety and Professional Wellbeing Edition, a profession where we can stop blaming the nurse for every wound that the system inflicted, and we can start healing the actual injury. My daughter is doing that work now. She has the framework that she didn't have in those first 3 months. Now, I cannot give those first 3 months back to her. Nobody can. But I can put the right blueprint in the hands of the next nurse that the system takes and extracts its pound of flesh from. That's the whole reason that this work exists. Not because I'm the only one that can do it, but because someone had to. A nurse, a scientist, a trauma researcher, an educator, and an author, all in one person who decided that this was the legacy worth retiring from an academic path to do. Because who heals the healers? That's the question that I have built my life around. And the answer turned out to be all of us once we finally have the right map. If you're listening to this and something in your body is nodding along, I want you to trust that. Your body has been telling you about this longer than anyone has been willing to listen. The nervous system reset is open right now. 3 half days, June 26th through the 28th. An intentionally small cohort. The only live immersive event this year. And enrollment, it closes Sunday, June 7th. So come do the healing work. I'll be right there beside you, as will the other nurses who are reclaiming their health and their power back from the system that took it. Everything you need is drlorrelaws.com/reset. drlorrelaws.com/reset. And enrollment closes Sunday, June 7th. I would be so honored to do this work with you. From my healer's heart to yours, namaste, and remember, it was never burnout. It was always nurse-specific trauma, and trauma can heal.